Hello, thank you for your interest in the PGY1 residency program with Mayo Clinic Health System Mankato. This presentation will provide you with a general overview regarding our PGY1 residency program, including a brief history of the program, details regarding required and elective learning experiences, travel opportunities, as well as research opportunities. This presentation will also discuss the wide array of teaching and learning opportunities that our residency program provides. Throughout this presentation, you will notice the core curriculum of the residency program aligns to the three shields of the Mayo Clinic logo, which represent patient care, education, and research. Before discussing the specific details of our program, I would like to provide some organizational information regarding Mayo Clinic. Mayo Clinic has campuses located in Minnesota, Florida, and Arizona. Rochester, Minnesota is the hub of the Mayo Clinic Midwest region that geographically includes portions of Minnesota, Wisconsin, and Iowa. This region consists of over 50 communities as well as more than 1,000 physicians and 15,000 allied health staff members. As pictured on this slide, the Mayo Clinic Midwest consists of 4 smaller regions. On the left side of the map, located within the red box, is the Mayo Clinic Health System Southwest Minnesota region, with Mankato serving as the hub of this region. It should be noted that Mayo Clinic's primary value is the needs of the patient come first. This is true regardless of geographical location. Before I transition to details specific to the PGY1 program in Mankato, I would like to mention the top picture on this slide is an image of the hospital that includes the expansion and modernization of an additional 120 beds to our institution. This new bed tower expansion was completed in May of 2024 and brought the total number of licensed beds to well over 200. Additionally, the bottom image is an exterior picture of the new pharmacy that was recently built. Pharmacy services moved into this location in February of 2024. Our PGY1 residency program was first established in 2009 and has been ASHP accredited since the program first originated. Following an ASHP site visit in 2019, our program was awarded the maximum 8-year length of a reaccreditation. This is a direct result of the commitment to excellence each individual involved in our program has committed to displaying. Also notable is the program expansion from 1 PGY1 resident to 2 PGY1 residents in 2020. This expansion has certainly been a positive experience for our program leadership, preceptors, and residents. Mayo Clinic has also integrated curriculum standardization throughout the pharmacy residency program across the Midwest region. Additional information regarding resident involvement in research, education, and clinical practice will be provided on upcoming slides. The goal for each of the residents in our program is to develop into proficient, independent general practitioners capable of providing broad pharmacotherapy knowledge to a multitude of patient populations. Past graduates from our program have gone on to work and establish practices in many different settings. This includes community-based hospitals, academic medical centers, as well as completing PGY2 residencies in critical care, infectious disease, ambulatory care, and administration, to name a few. Mayo Clinic Health System has also hired a significant number of past residents, many of whom continue to be a significant part of the current precepting team. Pictured on the right side of this slide is a map of the Mayo Clinic Southwest Minnesota region. Circled in red is Mankato, which I mentioned previously serves as the hub of this region. With the recent bed tower expansion, Mankato's community-based hospital is currently licensed for over 200 beds. Hospital areas of practice include but are not limited to internal medicine, a robust orthopedic surgery practice, general medical intensive care unit, extensive cardiac care, including a cardiac catheterization lab, as well as 24/7 emergency department services, including level 3 trauma and primary stroke center. Mayo Clinic Health System also has 3 clinics located in Mankato. Ambulatory care services are provided at each of these locations. Details regarding these services will be discussed in upcoming slides. Also located within this region are 3 critical access hospitals located in New Prague, St. James, and Waseca. Average daily census for these hospitals can range from 2 or 3 patients to up to 20 patients. The patient population can include caring for patients with common medical conditions such as pneumonia or heart failure, as well as patients requiring short-term rehab following extensive surgeries at Mayo Clinic Rochester. Also located on this map is the Fairmont site, which has an average daily census of 20 to 25 patients. The pharmacy services provided at each of these sites include clinical inpatient and emergency medicine services, as well as the same extensive ambulatory care services that are provided at the Mankato sites. The pharmacies at each of these outreach sites have business hours of Monday through Friday, 8 to 4:30. When they close in the evenings and on weekends, remote pharmacy services are provided by pharmacists located in Mankato, as all sites within Mayo Clinic utilize Epic as their electronic medical record. Next, I will provide you with details regarding the required learning experiences for our residency program. The first learning experiences the residents complete are a comprehensive 4-week orientation that focuses on central pharmacy operations, followed by a 4-week internal medicine 1 learning experience. These first 8 weeks are used to introduce the residents to Epic pharmacy department protocols, as well as gaining a strong understanding of workflow both within the pharmacy and up on the medical floors. I would like to emphasize that following the general orientation and internal medicine 1 learning experiences, we like to tailor the residency program to the resident's career aspirations. By this, I mean the order in which a resident completes each of the remaining required learning experiences is based on their career goals. For example, if a resident has an interest in a specific area of medicine, such as critical care, infectious disease, or ambulatory care, those could be the next learning experiences residents complete. This is done so that if a resident has an interest in completing a PGY2 in a particular area of medicine, they will have completed that learning experience prior to ASHP mid-year and can further explore PGY opportunities in those areas of medicine. In addition to the order in which learning experiences are completed, our program allows for flexibility regarding the duration of each required learning experience. Listed on this chart is the minimum duration of each required learning experience. If a resident has an interest in extending a particular learning experience, that could certainly be explored. As previously mentioned, Mayo Clinic Health System Mankato has a general medical ICU. During the critical care learning experience, the resident participates in interdisciplinary rounds with the rest of the care team each day. As the learning experience progresses, the resident is given autonomy to attend rounds on their own, which provides for a great learning experience. The infectious disease learning experience is precepted by our antimicrobial stewardship pharmacist and also includes rounding with the infectious disease team as well. The ambulatory care learning experience consists of spending time at the 3 different clinic locations in town. This practice has extensive collaborative practice agreements focusing heavily on pharmacogenomics as well as an emphasis on outpatient anticoagulation. The internal medicine 2 learning experience typically occurs in the second half of the residency year and gives the resident a great opportunity to work directly with the Mayo Clinic Family Medicine resident team within our health system, as well as an opportunity to precept IPP or APPE students. I had mentioned on the previous slides that the Southwest Minnesota Mayo Clinic Health System region has 4 other hospitals in addition to the Mankato campus. A 4-week health system or regional practice learning experience occurs at one or more of these locations. This learning experience focuses on pharmacy inpatient practice, ambulatory care, as well as outpatient infusion orders. It is worth noting that the resident will work closely with an assigned preceptor for each of these learning experiences. Similarly, each resident is paired with a preceptor for each of the longitudinal learning experiences. These are learning experiences that each resident will participate in throughout the 12-month residency program. Additional information will be provided in upcoming slides regarding research, quality improvement, as well as teaching and learning. The professional development and management learning experience provides for unique opportunities for residents to participate in various committee work throughout the Mayo Clinic enterprise, as well as develop or enhance communication skills, time management skills, as well as collaborate as part of many different teams. Emergency response is another required longitudinal learning experience. As part of this learning experience, residents complete formal, advanced cardiac life support training through the American Heart Association and gain valuable experience attending and participating in medical emergencies throughout the year. Finally, each resident is required by ASHP to staff 32 hours per month above and beyond time spent during other required learning experiences. Each of our residents fulfills this requirement by staffing every 3rd weekend, which provides 16 hours, plus 1 weekly 4-hour shift following completion of daily learning experience activities for that day. Hours for this 4-hour shift are typically 4 to 8 p.m. The weekend staffing component consists of a combination of central and decentral duties, and the 4-hour staffing shift is primarily a central pharmacy shift, which allows residents to gain valuable experience in each setting. Each resident will be assigned 2 holidays at the start of the residency year, and no assigned call or overnight staffing is expected of the residents. Listed on this slide is many of the elective learning opportunities offered in Mankato that past residents have completed. Similar to the required learning experiences, these elective learning experiences can be tailored to the resident's career goals as well. Typically, scheduling allows for 2 electives to be completed throughout the residency year. Unique to our residency program is the opportunity for Mayo Clinic Health System residents to complete 1 or 2 learning experiences in Rochester. This typically occurs during the second half of the residency year. Residency leadership works closely with each resident to identify preferred elective opportunities offered in Rochester that may not be available in Mankato. Examples of this include but are not limited to cardiovascular surgery, intensive care, oncology, pediatrics, neurology, and transplant, to name a few. The residency program also provides for numerous opportunities to travel. These include assisting with College of Pharmacy recruiting during career fairs, as well as attending the Minnesota Society of Health System Pharmacists mid-year clinical meeting, typically held during September in Brooklyn Center. The residents also have the opportunity to attend the mid-year clinical meeting hosted by the American Society of Health System Pharmacists in December. As part of this meeting, Vizient, one of the nation's leading healthcare performance improvement companies, hosts a poster session that allows residents an opportunity to present their quality improvement projects. The following slides will discuss information regarding longitudinal projects, namely research, quality improvement, as well as teaching and learning opportunities. As part of the residency curriculum, each resident is required to complete a research project. The goal of this research is to prepare a manuscript worthy of publication upon completion of the project. Mayo Clinic prides itself in providing support to each resident throughout the entire process. This includes hosting research workshops that guide residents through every step of the research process, from hypothesis development to writing a manuscript. Each resident is also paired with a mentor who will serve as a source of knowledge and offer constructive feedback throughout the research project. Each resident is also allotted funding and access to a Mayo Clinic biostatistician. Residents are also required to participate in a quality improvement project. This includes achieving bronze quality certification through completion of online Mayo Clinic modules, as well as participation in an enterprise-wide quality improvement project. Residents will get to choose from a list of topics that Mayo Clinic has identified as high priority in order to maximize the quality of patient care. Residents will work closely with 1 or more other pharmacy residents as well as preceptors throughout Mayo Clinic to complete this project. Residents also have plenty of opportunities to be highly involved in various committees during their residency year. Smaller quality improvement opportunities arise while serving on these committees in regards to medication safety, clinical practice, and pharmacy operations. Our residency program also offers a wide array of teaching and learning opportunities. This includes attending a teaching and learning workshop with other Mayo Clinic residents at the beginning of the year that introduces you to skills necessary to be a successful preceptor. Our pharmacy department hosts many IPPE and APPE students throughout the year, giving residents ample opportunities to develop and hone precepting skills. Each resident then develops a teaching philosophy by the end of the residency year in order to achieve a Mayo Clinic teaching certificate. Mayo Clinic has recently started a physician assistant program. Included in the curriculum for this program is the opportunity for pharmacy residents to formally teach portions of the pharmacology course. Each resident is also required to present 1 pharmacy grand rounds presentation during the residency year. During this presentation, residents formally present from Rochester on a topic of their choice to not only other Mayo Clinic pharmacists, but also providers who can then claim continuing education credit. These presentations are viewed virtually within Mayo Clinic, but are also available afterwards via podcast mediums such as iTunes and iHeartRadio. Residents also have many opportunities to present locally to the family medicine residents in a much less formal setting. In regards to all presentations, residents work closely with a preceptor regarding topic selection, slide content, as well as presentation skill development. Mayo Clinic also provides numerous opportunities for organizational and department education. This includes an extensive Mayo Clinic pharmacogenomics curriculum taught by Mayo Clinic's pharmacogenomic experts. This education session teaches residents clinical application of pharmacogenomics and allows them to earn a pharmacogenomics certificate. The Southwest Minnesota Mayo Clinic pharmacy team consists of over 40 pharmacists, 30 technicians, and 3 interns. Our pharmacy department has a combination of a central and decentral practice model. Pharmacists are located within the pharmacy to help assist with order verification and dispensing of medications, but most of the pharmacists are located outside of the pharmacy providing comprehensive clinical services, patient education, answering provider consults, as well as responding to medical emergencies. The pharmacy services in Mankato are provided 24 hours a day, 7 days a week throughout the calendar year. Located on this slide are many of the services our pharmacy department provides to our patients on a daily basis. All of these services are incorporated into the required or available elective learning experiences throughout the residency program. In summary, when clinical practice, education, and research are integrated together, a comprehensive residency practice is established. What is unique to the residency program at Mayo Clinic Health System Mankato is that this comprehensive practice takes place at 3 distinctly different locations, namely a critical access hospital, community-based hospital, and large academic medical center, all within the same healthcare system. To conclude this presentation, for those who have never been to Mankato or are unfamiliar with the area, Mankato and the surrounding region has a population of around 100,000 people. Located just over an hour from both the Twin Cities and Rochester, Mankato has many activities to participate in and places to visit throughout the year. A few examples include state parks, indoor and outdoor concerts, downhill skiing, as well as Mayo Clinic-sponsored Mankato Marathon. Additional information regarding our program can be found in the accompanying website, and any follow-up questions you may have will certainly be answered during your interview. Thank you for your time, and we look forward to learning more about you at your upcoming interview.